According to a New York Times poll, when people were asked about the role of money in the American political campaign system, do you believe money has too much influence, too little influence, or just about right? 84% of respondents said that money has too much influence in politics. In real terms, what does that really mean? A lot of times people don't really understand how money affects the political system and does real, tangible harm. So let's look at assisted suicide, also known as euthanasia, supported by about 68 to 70% of the general population. When people all across this country had their loved ones suffering, where they are terminally ill, maybe they have a year, 6 months to live, and are basically heavily medicated and forced to be subjected to drugs to manage their pain. And oftentimes, these drugs medicate people to the point where they're unable to think, to the point where they are unable to even recognize their loved. You have situations where there are Alzheimer's patients who gradually lose their memories, losing who they are, and they are mandated by their own government to live the rest of their lives in pain and suffering. But why? What is really going on here? You have people who are losing their minds, who are in constant pain, and they know they are going to die, and they are subjected to torture, in a sense. If there were laws where people could work with their doctors in end of life treatments, people who are terminally ill should have the right, according to 68 to 70% of the American public, they should have the right to be able to work with their doctor to end their own lives, to end their suffering, assuming they know there is no cure for what they have, knowing that they will just live out their last days in pain. Some people losing their mind, losing their mental faculties. So, where does the money in politics become a part of all this? Well, if you think about it, people who are in end of life care often are spending thousands, even hundreds of thousands of dollars through Medicare, taxpayer dollars used to keep terminally ill people alive, medicated, often in hospice care. And what they're doing is they are torturing people and inflicting pain in the name of money. The hospitals, the doctors have the influence over Congress where they can inject millions of dollars into state government, into the federal government, saying end of life care is wrong. And if you look at it by political party affiliation in terms of end of life care, even a majority of Republicans, 61% of Republicans believe in assisted suicide, 72% of Democrats, and 80% of independents. And there are actually two wordings of the question, where Form A, where when a person has a disease that cannot be cured, do you think doctors should be allowed by law to end the patient's life by some painless means if the patient or his family requests it? And if you word the question in that way, 70% of people say yes, the patient should be able to end their life by some painless means. And there's another form which historically less people agree to, Form B, when a person has a disease that cannot be cured and is living in severe pain. Do you think the doctor should or should not be allowed by law to assist the patient to commit suicide if the patient requests it? And that term, commit suicide, for whatever reason might have more negative connotations. To say someone ended their own life versus committed suicide, there is more negative connotations on the words commit suicide than ending life. But if you really think about it, there's another way to word this question. Do you believe there should be a government mandate to prevent terminally ill patients that cannot be cured from ending their life with doctor's assistance if the patient and his or her family requests it? Would you support such a government mandate? Because that's what it is. This is what a ban on assisted suicide is. It is a government mandate that people must live in pain so that hospitals will profit, that drug companies pumping people full of drugs will profit, and that doctors will profit. And that money is shuffled back to the federal government. It is funneled back to Congress Do you believe this government mandate is correct? Do you believe this government mandate is in the best interest of society? When Americans were asked on the moral acceptability of doctor assisted suicide, 56% said it was morally acceptable, and only 37% said it was morally wrong. But if you look at it on another level, even if you believe doctor assisted suicide is morally wrong, does that mean that your morals can dictate the morals of others? Do your morals so supersede another individual where they cannot make their own choices in life? That is the question. And if you look at this question by every single age group, 81% of those 18 to 34 support doctor assisted suicide, 65% 35 to 54, and 61% 55 and older. Every single political affiliation, Republican, Independent, Democrat, all by 60% and up, 61 to 80%, all say, yes, we support doctor assisted suicide. So the general public supports it nationwide. And what you have is drug companies, hospitals, doctors, and Congress all making money off the torture, the pain, the suffering of people. That's what money in politics does. It causes real, tangible suffering, where what the American people believe to be right cannot be passed by the Congress because the Congress is getting money to them through the companies that say there should be no assisted suicide. We are making money off of these dying people. It is not a religious argument, it is an argument, plain and simple, money in politics. It is causing real, tangible harm to people.